Let's see what is going on. Well, it is super cold outside, and all that noise and commotion out there was a political rally going on. And we're not going to get controversial, we're not going to talk about politics. We're going to go into something that's a lot more accepted, and it's actually the sixth and final use of the BC liner. And the topic that I'm talking about that is not controversial is the idea that restoration of the endodontically treated tooth should occur as soon as possible, or at least the coronal seal that is far more adequate than the traditional cotton and cavit should be placed as soon as possible. As we know, out of sight, out of mind, as soon as the patient's symptoms are oftentimes alleviated with the root canal therapy, they tend to take way too long to proceed to the next step, which is the restoration of the endodontically treated tooth with a core buildup and sometimes a crown or just the filling. And it's very important in these cases, as the endodontist oftentimes is not responsible for the second phase of this treatment. Traditionally, we've placed cotton and cavit to fill in this state temporarily and provisionally for the patient, and patients have most of the time proceeded to get the final restoration, usually within 2 to 4 weeks after root canal therapy, giving just enough time for the healing to take place, and patients have enough time to figure out if the tooth is doing well before moving on to the next step. But sometimes, as I've said, due to various reasons, procrastination or financial limitations, patients take too long, and many times you end up seeing cases where the patient did not restore the tooth, and 6 months, a year, year and a half, 2 years have passed, and now the tooth is unrestorable due to extensive decay that is taking place because of the cotton and cavit. Now, what the BC liner comes in here is as a provisional liner, as a canal cap that you could place on top of the root canal therapy tooth on the furcation floor or immediately over the gutta percha, where the sensitivity of leak is the most kind of prevalent. By placing this bonded restoration on top as a canal cap, you can improve the seal. Now, one other possibility is, instead of just placing a canal cap and then proceed to put the cotton and the cavit, you can place the BC liner, especially now in the blue formulation, fill all the way up to the top, or even the tooth collar version, and use that as a long-term provisional. The long-term provisional use of the BC liner is very helpful in these particular situations, and also in cases where you want to just wait a little bit longer to find out the status of a tooth. For example, you may have seen a crack in the tooth, or there may have been a repair perforation before the patient goes on to restore the tooth with a final restoration and incur additional investment into the tooth. You may want to make sure that this tooth is a good candidate for saving prior to additional investment. And in these cases, you do need to have a longer term provisional, and cotton and cavit is certainly not a very good long-term provisional. So here you can fill up all the way from the floor to the top with a BC liner, and the advantage of this, again, compared to just placing a bonded type of a composite in this case, is the fact that you have something that doesn't require etching and bonding, and that you are able to then remove easily, and has then enough compressive strength as a base that you can then bond your final restoration to down the line whenever you want. And especially using the blue version, you'll have enough contrast so that you can just selectively remove the BC liner and by 3 or 4 millimeters, and then have another 2-3 millimeters of the floor that would act as a base, and then you can place your core followed by the crown. So this is another use of the BC liner, which is very helpful in cases in which you want to have a long-term provisional. You can place this very quickly and inexpensively, and it doesn't require trituration, so BC liner is very handy. And now with the blue contrast, you're able to remove it later on if needed for replacement with another kind of a restoration. Of course, if you really want to have the material stay in there for very, very long, we're talking years, you are able to add your etching and a bonding agent, and the material would then stay for a very long time in there. But this is just a quicker way of using it without the etching and the bonding for several months and so on. Anyway, so I wanted to share this little example with you as well as the final most common use of the BC liner. That's it for this video. I'm going to come back in the next video and share with you some tips and tricks for improving your seal and avoiding any voids in the fill, as well as best uses for saving the bulk of the material. See you in the final video of this series on BC liner. All right.